Prematurity is one of the leading cause of neonatal death and morbidity. And the patient's or the baby's admission in the hospital is for a very prolonged period. Many of this prematurity can be detected and also prevented. So we generally divide prematurity into that which can be prevented and that which may not be able to be prevented. Okay. Now, being an obstetrician, we know that we can detect certain of this condition and prevent. Prematurity can also be iatrogenic. Iatrogenic means medically induced, or we may have to deliver the mother prematurely because of certain medical conditions. So first I would like to deal with the medical condition in which we may have to decide on premature delivery. Most commonly the cause of prematurity for a maternal reason is hypertension. Hypertension is specifically happening in pregnancy, which we call it as pregnancy induced hypertension. This can be related to the placental function of the index pregnancy, or because of any other pre-existing conditions in the mother. The most known factors associated with hypertension in mother is one is if the mother is already hypertensive when she is conceiving, or when the mother is very on the overweight or obese side, if she is diabetic, and elderly age. These are the four most common reason of hypertension in pregnancy, where we can prevent if the mother gets up prenatal counseling as to how she can optimize her health, so that this kind of complications can be prevented, like inculcating certain healthy habits, losing weight, making a very strict diabetic diet, and controlling the sugars at a very good level. We expect the HbA1c to be less than 6 or ideally less than 5.5 if that can be maintained, and if her reason for having an hypertension is detected and treated, because many of the time it could be because of hypercholesteremia or certain other renal condition which can be treated, so that we do not have an accelerated hypertension in pregnancy. And in pregnancy, again, there are certain reasons where they can develop without having this pre-existing condition. Mostly if it's a first pregnancy, and we have also seen the pregnancy resulting from infertility treatment also have a higher index of hypertension in pregnancy. So, can we really prevent this hypertension in pregnancy? Yes, there are certain parameters, or there are certain tests which we do to detect if that patient is at high risk of developing hypertension. More so, these tests are done at 12 to 14 weeks, what we call it as NT scan. At that time, we do certain blood tests. We also look at the blood flow to the uterus, which we call uterine artery Dopplers, and the maternal BP. When we combine all these three factors, and there is a specific test called as double marker, out of which we look at if the patient is, or the mother is at an increased risk of having hypertension. If we see that there are certain indicators of, that this patient or this mother could be hypertensive in this future pregnancy, then we can start them on certain treatment, more so involving something, blood thinners like ecosprin or immunomodulators, and even sometimes as drastic as starting them on heparin injections, which have shown certain benefit. But we also ask them to do certain lifestyle changes, and in our hospital we also have a program where we put them across to our yoga therapists, who will teach her how to breathe, how to take care of her stress, and certain exercises which may improve the blood flow to the uterus. So this is an integrated approach which could prevent the sudden onset of hypertension, which can later on result in bad outcome in the pregnancy. Then we keep them on a regular follow-up. Like after 12 weeks, then we again do a scan at 16 weeks to see how the blood flow has improved. If the blood flow has improved good, then that means to say that your chances are reducing. If the blood flow of the uterine artery is still remains to be having high resistance, then yes, we keep a closer watch. And our target is trying to cross the at least 34 to 36 weeks of pregnancy. So there should be a very stringent monitoring. So it's a more of an integrated approach, where we will also be having serial growth scans, looking at the blood flows, And if the patient develops hypertension in pregnancy, then again we start them on antihypertensives, and every 3-4 days, or within a 1 or 2 days, we call them for follow up, look at the BP, and try to avoid the complications of hypertension in pregnancy, so that we can avoid premature delivery of the baby.